The Health Secretary is naming the best and worst hospitals in new league tables in an effort to fix the National Health Service. And Wes Streeting joins us now. We'll come to the NHS in a second, Wes Streeting, but we've had the breaking news that Bridget Phillipson is standing for the deputy leadership of the Labour Party. Clearly a cabinet minister, she will be seen as Keir Starmer's candidate. Could we just confirm from you, you won't be standing, you will be supporting Bridget Phillipson, and that she will be expected to continue to abide by collective responsibility in the cabinet and support cabinet policies, or will she be allowed in a Labour election to have her own views, even if it meant saying, for example, I'm against Wes Streeting and his league tables?
In order, no, I will not be standing. I've got more than enough to do as the Health and Social Care Secretary. Secondly, I think Bridget is a great candidate for Deputy Leader. I think she's a fantastic Education Secretary and has been a big part of Labour's success from opposition through to government. I haven't yet decided who I am supporting. Got the news about Bridget this morning, so we will see. And I'd just say she's her own candidate, not anyone else's. And thirdly, I assume, unless told otherwise, that collective responsibility applies. And so as cabinet ministers, you might have your disagreements and debates behind closed doors, and believe me, we do. But you know, we come and we speak for the government publicly.
That is quite challenging, though, isn't it? Because there's a lot of unease, not just in the country, but on Labour backbenchers about aspects of government policy. We had Stella Creasy, the backbench Labour MP, yesterday saying the prescribing of Palestine action was the wrong thing, these arrests we're seeing in London, and she would be campaigning as Deputy Leader to reverse that. Doesn't it just sort of tie a cabinet minister like Bridget Phillipson's hands behind her back if she has to agree with everything that every government minister does? Doesn't it make it more likely that Keir Starmer's candidate's going to lose?
So I'd just say a couple of things. I think the deputy leadership contest is an opportunity ahead of next May's elections, where we've got crucial elections in Scotland and Wales and across England, to debate how we can best win, to reflect on things we've got right and the things that we have got wrong and the mistakes we've made in our first year. We've made mistakes. We're going to make mistakes in the future, by the way. We're human beings. We are imperfect. We are going to make mistakes. The critical thing is we've got to learn from them. So I think the deputy leadership contest is important in that context because we're effectively electing our campaigner-in-chief. That's been the traditional job of the deputy leader. I think the risk, though, and in some ways it's played out with the conversation we're having now, and this is why, you know, this is the risk I think the rest of us in government are mindful of. There's a risk that all the conversation becomes about one election for one job in the Labour Party. We're in government. We don't normally have these sorts of elections while we're in government. We're in government and we're getting on with the job, and we mustn't allow an internal debate about the deputy leadership to distract from the things that we're doing in government, from cutting NHS waiting lists and the work that our new Home Secretary is doing to secure our borders, the work that the Chancellor is doing on the cost of living and getting growth into our economy. There are lots of things going on and we mustn't allow this to be a distraction.
I think that viewers will totally agree. They'll wonder what on earth this deputy leadership election is, and it is going to take up so much of the oxygen. If only all of your cabinet colleagues knew how much tax they should have been paying. Speaking of which, we have a budget coming up at the end of November. Huge speculation about how much tax we're all going to be paying. But apparently the Prime Minister is saying he's going to put more cash into working people's pockets. Now, is that a sign that he's going to cut taxes for working people in the budget? Because how else is he going to put cash in everyone's pockets?
Well, those are decisions for the Chancellor and the Prime Minister to make at the budget, and how we get the balance right between tax and spending, trying to address the serious debt that Britain has, that we inherited, and also at the same time as we're trying to sort out the public finances, bearing in mind the pressures on family finances and business finances. And that balancing act is really difficult at the moment. You know, your viewers don't need me to tell them that. They'll be balancing their bills and they'll be worried about their businesses as well.
But they've just been told in the briefing about the Prime Minister that he's going to put more cash into their pockets. And of course, that's a hugely optimistic sign. But how is he going to do that? Is the minimum wage going to go up again, for instance? Is he going to put, I don't know, wealth taxes on people who don't have incomes and earn their wealth in other ways, perhaps on property. I'm not sure how this cash is going to be generated.
Well, we'll set out future decisions at the budget, but I'll give you a few examples of some things we've already done that have helped put cash in people's pockets. We've had the biggest expansion of carers allowance since the 1970s. That's an extra £2,000 for family carers, which has made a real difference for people there. The increase in the minimum wage we've already seen, you've mentioned, as well as above inflation increases that were put in place right across the public sector.
OK, so that's interesting. So you've just mentioned a very significant benefit and a minimum wage guarantee. I mean, benefits in particular need to be funded from somewhere. We know that cuts to welfare didn't go through. So how would you fund, then, an increase in benefits?
Well, in terms of future decisions, that will be set out in the budget. But the challenge of welfare reform still remains. I think we accept that it wasn't handled very well. And the way in which the government was proposing to go about it, I think, caused a lot of fear and anxiety and concern, therefore reflected in Parliament from people on behalf of their constituents, publicly as well as privately. And we'll learn from that and we'll approach it differently. Right. But you know, there is this central challenge, and the budget won't be easy, and the next couple of years won't be easy for the country, because what we're trying to do is get the public finances out of the hole that they were left in, at the same time as trying to help families and their finances.
I know
we're taking decisions. I mean, if you look at what I did on prescription charges, for example, I froze those for the first time in years because I recognise cost of living is an issue. So we're making decisions where we can. They've got to be fully costed and fully funded.
I know
we are trying to address both of those issues, family finances and the state of the nation's finances. It's going to take a bit of time, but we'll get there.
I know you need to go, but we do need to ask you about the NHS. We had the King's Fund saying this simplistic ranking will be destabilising for the underperforming hospitals. It's not fair. We've had a head teacher saying school league tables are stigmatising and can be very destabilising for head teachers. Explain to us why in schools and in the health service these rankings are going to deliver better outcomes for people.
So I really think that you've got to be honest about the problem as it is if you're going to tackle it. And we've used 30 different measures, 30 different data points to put together these NHS rankings. And that does two things, I think. One is make sure the public can see transparently what the situation is. It might help people to make different choices about where they're treated. And by the way, I accept that those choices are easier to exercise if you live in a big city with lots of hospitals, a lot harder in rural communities, and I know that, which is where I think the second benefit to the public comes, which is holding me to account as the Health Secretary, holding the government to account for making sure we're driving up improvements for people right across the country, everywhere, not just in big cities. And secondly, that is the use of these league tables for me personally, being able to look at the tables and ask some fundamental questions of NHS leaders. Why is it that Northumbria Hospital's top of the charts? Well, that's because they've integrated their accident and emergency department with local community services, so people get the right care in the right place at the right time, often, where possible, treated in their own home on the spot rather than being dragged in by ambulance. Right. And secondly, because of the way they set their clinics up, it means when there are challenges in A&E, they don't then just take up beds for planned care and cancel people's operations. And I'm taking the best of the NHS, the rest of the NHS. In fact, I nicked one of their former chief execs, Jim Mackey, to be the chief exec of the NHS nationally.
OK, we need to leave
it there. So that's the approach I'm taking.
Wes Streeting, thank you very much.
We promise to hold you to account with your league tables in the coming months.
I'll be back.